coronary artery disease and coronary artery bypass grafting. So coronary artery disease and coronary bypass grafting you should know as a MBBS students, you should be thorough with this. So there are two important vessels coming from the root of aorta. One vessel is left coronary artery. Another vessel is right coronary artery. Please understand the picture. So left coronary artery is a main vessel. Please understand that's a main vessel for the entire myocardium. It divides into left anterior descending, which descends anterior in the heart. Left anterior descending, and another one vessel is circumflex. So please don't forget that is circumflex vessel. Circumflex and left anterior descending. Right coronary artery descends down and becomes posterior descending artery. Posterior descending artery which runs on the posterior wall of the heart. So now if you have heard about triple vessel disease, what are the triple vessel disease? We call them left anterior descending, circumflex and right coronary artery. This is what we call it as triple vessel disease. Triple vessel disease. Main vessel disease. What is main vessel disease? Main vessel is left coronary artery itself is having a thrombus. We call it as main vessel disease. So please remember, left coronary artery divides into left anterior descending and marginal branch of circumflex. Right coronary artery continues as posterior descending artery, and most commonly diseased and most commonly bypassed vessel is left anterior descending artery. So arterial dominance is a word used based on posterior descending artery origin. So posterior descending artery, I told you, usually comes from right coronary artery. In 10% cases, it comes from left coronary artery also. So posterior descending artery is from right coronary artery in 90% and 10% from even left coronary artery. Okay, don't forget this. So to find out the thrombus in these three vessels, so please don't forget, this is an illustration I am making here. This is left coronary artery from the root of aorta. This is circumflex. This is circumflex. This is left anterior descending, and this is right coronary artery and posterior descending artery. So this is the vessels we are going to see, and if there is a thrombus, we can easily identify on this investigation called as angiogram. So coronary angiogram is the investigation of choice, and during the angiogram itself nowadays, when there is a narrowing, people have started doing a stent into this vessel called as Percutaneous Transluminal Coronary Angioplasty, PTCA.